Good evening, members, and welcome to our webinar. Tonight, we are going to finish up our POT4 graduation ceremony webinar. So last week, we did talk about what a POT4 is. We talked about what a graduation ceremony is. And tonight, we're going to show the video. We actually made this video so that you can see how great our acting skills are, for one, and two, you can really see what it is that we do. First, real quick, we are going to be in Oregon in about 2 weeks on December 2nd. So as Dr. Sheldon said last week, if you're in the area, come see us. We're going to be seeing the Oregon Associate, what is it?
Oregon Society of Periodontists,
Yes.
and it'll be in Portland, downtown Portland, on Saturday, December 2nd, at around 8:30, I think, 8 a.m.
Yes, so we're going to be over there. If you're close enough to come see us, by all means, come see us. We'd love to see you guys. Then we're going to be in Arizona in January doing the same thing.
It's Phoenix.
Not sure when exactly, but it is going to be in January.
January 20-something or other.
That's when we're going to be there. And then, as we said,
the Arizona Society of Periodontists.
Yes. 2018, we are going to do quite a bit of touring. We will be releasing some of those dates soon, let you know where we're going to be. So if we're close to your area, you guys can come out and see us. Also tonight on your screen, you'll see we have 3 attachments for you guys to go on ahead and download and keep that we are including of what is in our graduation ceremony packet that we give our patients. Those are the 3 forms that we have in there that you can go on ahead and keep for yourself to duplicate or just see what we're talking about in there. So tonight we're going to talk about, we're going to show the video on how we do our post-operative check number 4, which is our final check on the treatment we have done. We have acted out what it is that we do on this video. And for those of you that were not here last week, a POT4 is our final product. It is to check our final product, our quality, so that we can get the patient excited to tell everyone they see for the next few days at least about you and what you gave them and what you did for them, and of course this amazing experience they just had during this ceremony that you're giving them. This is all about celebrating the happy moments when the patient is so relieved and so excited that they're done, they finally got what they paid for. This is the time that you are going to celebrate, as well as gather the things that you need to show other potential patients what it is they could get as well. So during this, you're going to see that we give some neat stuff. We give some exciting stuff. We recommend that you do the same thing. So you want to get some things that they're excited to take home with them and that they're actually going to use and remember you by. So during this, we are going to be capturing a success story, which in combination with the photo is probably one of the most valuable things you're going to be getting, because we still to this day use success stories that we've got 5-10 years ago. So you're going to get a success story. These are extremely beneficial. We use them for our website. We use them for a lot of our internal marketing. We use them for newsletters. We share them with other patients. This is the best time to ask for it because, again, they are extremely excited about what's happening. We're also going to talk about gaining a Google review at this time. Gaining a Google review while they are in the chair, not just sending them away with something to say, hey, please would you do it, but while they're in the chair. And we'll talk about that a little bit at the end of what we use to do that. And you'll see that since they're in the chair, we can coach them to a 5-star rating, and we can coach them to say something amazing while they're sitting there because you're interacting with them. It's so much more successful than sending them home. However, we still do it when we need to, because some patients don't have a Gmail, or some patients want their, for whatever reason. But most of the time, I think all in all, we are getting all of them while they're in the chair. People do Google everything. You know that. We know that. It's just that kind of a world right now. So if you're interested in something, if you're looking for something, you Google it. You Google it. You research it. You look for the stars. You look to see what people said about the company or the product, and that's what we're doing here. We're also asking for referrals. This is the greatest time to ask somebody to refer somebody to your office because they want to return the favor to you. They want to do something for you because now you've done something for them. So this is the most likely time they're going to refer somebody to your practice. You're also going to be checking on the final product. You're going to be making sure that everything is what you promised it. You're going to make sure that the crown is good, the bridge is good, the prosthesis is good. You are checking it at this time, and you are going to be communicating that back to the general dentist. So get them excited, get them happy, thankful, give them something to leave and talk about, and by all means, at the very end, take a photograph, because that as well you're going to be using for all those same types of internal marketing. It's golden. We use ours for so many different things. So let's go on ahead and watch that video, and that way you can see what it is we do.
Now, you've received the email earlier today, so you know how stilted the video is when you look at it on this GoToMeeting format. So if you want to just go to the video and watch it, and then go to the YouTube link that I sent to you, you can watch it there, and then we'll comment on it after you get done. So we'll all be done around the same time. So we'll start the stilted video right now. You do what you'd like to do, and we'll see you in about 9 minutes and 50 seconds.
Hi, Tasha. How you doing?
I'm doing good.
Good. So you got that crown placed by Dr. Matt a couple weeks ago?
Yeah, I think it was like 10 days ago.
Okay. All right, good. So are you able to bite, chew, eat,
Yep.
everything like that? Feels pretty natural?
Feels natural.
You're able to floss pretty good?
Mm-hmm.
Great. Okay, so today it's your final ceremony day, okay?
Woo!
So this means it's your last day with us as far as that procedure goes, okay? From here
Good.
on, we're just going to do cleanings and maintenance and that kind of thing, okay?
Awesome.
So we've got a few special things for you.
I'm so excited.
All right. So what we have here is what we call our success story.
Okay.
You may have noticed that out in the waiting room, we've got a whole book of success stories.
Yeah.
And basically what that is just a story. Basically, it's your story with us.
Okay.
So it can be a few sentences, a paragraph or so, whatever you want it to be.
Okay.
But it's just your experience with us.
Okay,
You
perfect.
can mention your lovely dental assistant if you would like. That's up to
course.
you, of course. But just kind of, it's letting other patients and new patients know your experience with us. Okay?
Perfect. Yeah, I
All
can
right.
do that.
Another special thing that I really would encourage you to do, and we would
Okay.
really appreciate, Dr. Sheldon's probably going to ask you for it too, but is a Google review.
Okay.
It's really important for us because a lot of our patients come to us through the internet or, that way. So, do you have your phone on you?
Of course.
Can we do a Google review for us right now? It's
of
very
course.
simple. Very simple. So
Okay.
I'm just going to send you, it's called an invitation to do a Google review. So if I can get your phone number.
321
Okay.
259
Okay.
9980.
All right. I'm going to send that to you now.
Okay.
It says it was sent.
Yep, I got it.
All right. So go ahead and let's go through it together
Okay.
to make sure. It's going to give you options to post on Facebook or whichever way you want. So
Okay.
let's see. Make sure it all works. And we really appreciate these because so many of our patients do come to us this way. A lot of patients are seeing, Facebook reviews and things
Of course.
like that.
That's why I look up
and-
everything.
Yes. So,
So-
do you have a Gmail account?
I actually do.
Perfect. So I'll say yes to that.
Okay.
And if you didn't, we could do it through Facebook or something else as
Okay.
well. Okay.
Sure.
Excellent. So there we are.
And then I write a review.
That's right. So you can select 5 stars, please.
Okay.
And then from there, it doesn't have to be a long review, but just something telling us, how wonderful we are.
Sure, of course.
We appreciate that.
Yeah.
Okay, well, we've already taken your x-rays a couple weeks ago, so Dr. Sheldon already can see that from Dr. Matt's x-ray. So everything is looking good there.
Okay.
We'll get a few pictures later after Dr. Sheldon comes in.
Uh-huh.
And but let's go ahead and get him in. I'll let
Okay.
you finish your review,
Okay.
and I'll go get him. Okay.
All right, sounds good, thanks.
Great.
Well, hi, Tasha.
Oh, hey.
Good to see you. I
You
understand
too.
we're all done.
Yeah, apparently.
Good. Let's take a look at that.
Okay. Just finishing up that Google review.
Oh, thank you, thank you, thank you. It's so nice.
course.
So many people read those Google reviews and it makes a big difference to us. So how's the crown feel?
Everything feels good. Feels like my natural tooth.
Oh, that's good. Let's take a look at it and see what's going on.
Okay.
Oh, good. Color's really, really good. Let's check the bite.
Okay.
Okay, close down. Good, good contact. Good. Let's check this articulating paper.
Okay.
Good. Bite down. Good. Nope. Yep, bite's good. Let's check the margins, make sure everything's all right.
All right.
Good. Everything looks real good.
It feels good.
Good. So, Tasha, I don't know if you know this. Oh, you're anticipating something, aren't you?
I am.
Yeah, okay. Well, you know, there's lots of reasons people get dental implants done here.
Mm-hmm.
You know, it's what we do. But really, the real reason people get their dental implants done here is for the dental implant graduation ceremony. Are you ready to participate?
I'm so excited.
Oh, that's good. So, you've just completed implants at the heart of dental implant therapy in all of Melbourne, Florida. Solid Bite, 2223 Sarno Road in Melbourne, Florida. Congratulations.
Thank you.
And for that, you deserve some gifts.
Okay.
So, are you ready?
I love gifts.
Good. So, here's the first thing.
Are they diamonds?
Not quite, but something that might be even better.
Oh.
This is something women have wanted my entire life. Do you know what that is?
Couldn't guess.
My phone number.
Oh, man.
Yes, so you just call me anytime you need me.
Okay.
And of course, there's a business card here in case you forget
Perfect.
what I look like. Okay?
Thank you
Good.
so much.
There's more.
Okay.
Do you go out to eat very much?
Yeah.
You do?
On the weekends, yeah.
Well, I want you to have the same pen that you've used in every restaurant to.
I've used that
to
pen.
Yes, you have. So you have your own Solid Bite pen.
Perfect. Thank
Good.
you.
Now you think that would be enough. But guess what?
There's more.
There's more, yes. So there are times I'm sure that you're out in the dark and you want to make sure that you can see, okay, yeah. All right, very good. So we have the famous Solid Bite flashlight.
Wow, that's
And
handy.
ordinarily we'd use it this way.
Uh-huh.
I want you to use it this way so everybody sees the beautiful implanted crown that you've had done.
And of course, we mentioned you, right?
Of course, yeah, of course, yes. And
Perfect.
there is that beautiful designer box
Okay.
that it comes in.
Perfect.
I think that's enough. No, but there is more. You know, we have, you came in for $79 and you got the full examination.
Yeah.
People who refer to us, both referred by patients as well as other doctors, come in a different way.
Okay.
They donate $50 to charity and they get the full examination, x-rays. So all they do is come in and write a check to charity, $50 or more. And we're very proud of that because we've collected over $160,000
Wow.
for our charities.
That's
So
amazing.
all you have to do
Okay.
would be to give this to your friends as long as you have their name there, or
Uh-huh.
even if they just tell us they were referred by you, that
Okay.
they'll be able to get that
Perfect.
that discount as well.
Awesome.
Okay, good.
Yeah.
Now, I'm sure you've seen this. You probably had this. I
I've
wanted to
had
make
it.
sure that you remembered what we looked like.
Oh, those handsome faces. How could I
Oh,
forget?
Thanks. Yeah. So, yes, here's the beautiful faces right there. Yes. So, sometimes when people are introduced to new dentists, it's nice to be able to give them a magazine, or
Right.
even better, give them a copy of the book,
Oh.
because how many dentists write books, and so
Yeah.
they can see there's something to this, and we've devised this book so that any questions, any dental questions, can be answered. That might be really, really helpful.
Yeah, sure.
And there are a lot of people who have questions; they're not sure, and this might be able to help them as well.
Awesome.
Okay.
Thank
That's
you.
great. I appreciate your referrals.
Yeah.
And finally, there is that reason that people come in. It is the T-shirt. Yes, the Solid Bite T-shirt. Worn by many all over Brevard County, and now you have yours.
I'm so excited.
This is the back of the shirt.
Okay.
But there's only one reason that people would look at the back of the shirt,
Uh-huh.
and that's because they read the front of the shirt.
Oh my goodness. That's hilarious.
So would you mind taking a picture of us? Let's take the bib off.
Okay.
And we'll take the bib off for you.
Thank
Good.
you.
And let's put it on there, and
right.
you want to take a picture of us? We're going to show this picture. Remember when you came in and you...
In the little consult room?
Yeah, in the little consult room, and you
Okay.
saw the pictures.
Yeah.
So you'll have your picture there too?
Sure,
Good.
that's fine.
That's great.
Okay,
1, 2, 3. Smile. Good.
That's
awesome.
great.
That's great.
Thanks.
Tosh, it's a real pleasure having you as our
Yeah, you
patient.
too.
And we'll want to see if you recall visits for cleaning, make sure everything's okay.
Okay.
If you need anything at all, just give us a call.
Sure,
Okay.
will do.
Thank
Thank you, Dr. Sheldon. It's been a pleasure.
We hope you have enjoyed this video. If you have any questions in regards to it, please email us.
The American Association of Independent Periodontists is there to help every periodontal practice do better. I'm Dr. Lee Sheldon.
And I'm Danielle Dorner. We'll see you on the next video. All right, guys, so you can see the things that we were giving our patients, and I do recommend that you do similar, if not the same thing. Those t-shirts are a huge hit. We have people that want to try to buy those t-shirts from us. We have people that work in industries where they can wear t-shirts or go to the gym, and they want those shirts to wear to the gym and to those places. I highly recommend that you get ones made for your practice, same thing. So that's a very hot item that is in that packet, and people do laugh and they love it, and they wear it back to come see us when they come for their cleanings. They wear those shirts. So I do recommend that you do that as well.
Could they read? I don't know if they could read what the t-shirt said.
Well, it says, on the back it has our logo, it has our information, of course, because you want that on there. On the front it says, bet you can't guess which one's the implant. So it is definitely something that gets people laughing. It gets people just going on it. It's a great conversation piece. So definitely recommend that you guys do that. So in ours, we have the t-shirt, we have the little flashlight, we have the pen, the logo pen, which actually is a pretty big deal. People love those pens. We give out our Care to Share card to ask them to refer people back to us. We give them the 2 business cards and Dr. Sheldon's cell phone number. We give the magazine because we want them to give that to somebody else. It has a coupon on it. It has information in it. We ask them to share it with a friend. We give them the book. We give them the book, the nice, fat, impressive looking book, so that they can either read it themselves, but they probably already have, so give it to somebody else. We also have the talent release so that you can use that success story, so that you can use that photo that you have obtained. So be sure that you get that, the success story itself, and then the Google reviews form to take home in case for some reason they want to take it home with them. So we recommend that you put all that together in a packet as we do, so that we can give it out and not forget any parts and pieces in there. Give that to your patients so they can be just as excited. Now, we did use something we haven't talked about on this video, Dr. Sheldon. We used Banyan for our reviews.
So Banyan is used, notice when Courtney was sending that signal over to Tasha's phone, that was using Banyan, and we've talked about Banyan before. So Banyan is more of an instantaneous Google review system. We have given you the handout to do the manual Google reviews, which you can still do, but if you want to make it a little bit more seamless, then Banyan has been very successful for us in allowing our patients to write instant reviews rather than take the piece of paper home and hope they write the review. So look into that. It's good company. Now, you're looking at that, and of course, we were acting this out. This is all our staff. You know, Tasha's one of our assistants. And when you're in front of the camera, you know, it's a little bit different, but that pretty much simulates what you do. And you're looking at it and you say, how can I act like that? I'm not a fool like Lee Sheldon. How can I do that? And the answer is, you don't have to be me. You have to be you. I mean, there's a lot of fooling around that we do it. Not fooling around, that's the wrong way of term it. A lot of levity, a lot of things that we do where we have a good time in the office. And so it fits pretty well. I was a little bit over the top in the way we did it just now, and you want to get the patient's permission to do the graduation ceremony. There's some patients who don't want to have anything to do with it. You know, say, hey, we've got a dental implant graduation ceremony. Would you like to participate? The person says, no, I'd rather not. That's fine. We still give them the T-shirt, but we don't go through all of this rigmarole. And I'd say probably about 20% of the time, patients don't want to go through the ceremony. or sometimes I'm not in the mood to do a ceremony. You know, that can happen too. But the fact that you're doing something and doing something special and creating the opportunity for the success story and for the photograph is what we're trying to accomplish there. And also obviously the Google review in addition to the success story. Now, do you think I was this good the first time I did it? Well, you might not think I was good at all when you just saw me do it. But as with anything, you know, there's drilling, there's rehearsal. You just keep on doing it and doing it and doing it. You have to stretch a little bit in order to be able to accomplish this. And the first time you're going to feel like, you know, it didn't go well, but then you'll see the reaction of the patient and you'll say, gee, maybe I'm doing the right thing. And then you just keep on. I mean, it's the same thing as when you learned how to do a flap and how you made an incision, you know, the first time, and then you keep on doing it and doing it and doing it. You do better at that. The same thing with public speaking or doing something of this sort. I learned this from Charlie Martin, who's a general dentist in Richmond, Virginia, and he did his differently from the way we do ours, but he still did it and created the wow factor, and that's what you're trying to do, create the wow factor so that patients will speak well of you, so they will have, so they wear something, they have a t-shirt, they say, oh, you know what happened in Dr. Sheldon's office? Wow, it was really good. By the way, the male's version is, and I've already told you this, but some of you are new members, if you show me your implants, I'll show you mine. That's what the front of that t-shirt says. So, and by the way, the lettering is in white, not in pink. This is a stretch. But understand we're in a public relations world. This is the way it is, and people do respond, and they do have a good time. And I'm sure there are staff members of yours who could be just as good as Courtney, doing it the same way in order to be able to create this experience. So the POT4 experience, post-operative treatment fourth visit, which comes from a way in which we started doing our practice 30 years ago, but because we don't always do 4 post-ops, but
Yes.
we still call the final post-op the POT4. That's the way we do it, and that's what you can accomplish. Now, remember, and Daniel said this, getting the material is important, and compiling the material is important. And once you have a catalog of that material, a folder of that material on your desktop, however you're going to do that, have a folder of handwritten material, that becomes a nucleus for distribution, and you can distribute it in a number of different ways, and you keep on distributing it. It never gets old because it's a success story. It works. It works really, really well. So there are reasons to do the graduation ceremony. We can find it. We can find it at dental implants. I think we can expand it. We can expand it, you know, to any periodontal procedure or any dental procedure. We may be selling it a little bit too short by only doing dental implants. So see how you can use it and see how it can benefit you. And you'll find that if you put this in place, which means you get the gifts, get the forms. We're already giving the forms. All you have to do is duplicate the forms and put your letterhead on that. Then you can start to create a wow factor and get a lot more PR material out for yourself, which is only going to help your practice.
Yeah, and if you have been members of ours for a while, you know what a fanatic we are about check sheets. So we do have a check sheet for our POT4 process, as we do with every single process we do for POT 1s, 2s, 3s, 4, everything. So we have a check sheet. The girls take those check sheets and they go buy those check sheets. So when Courtney is saying what she's saying to the patient, she's asking what she's asking of the patient. She's having out on the table what she has out there to hand to Dr. Sheldon, also to do the check on the crown, the cellophane, the shim stock, the mirror probe, scaler, all that stuff. It's all on the check sheet. Everybody knows what they have out there, so you do the same thing all the time. You don't forget anything. Same thing with what we give the patients. We pre-make those in packets, so we just pull a POT4 packet, and that way we don't forget to give anything during that. But our goal, of course, is to make sure our patient is happy. They're satisfied. They feel like they've got what they paid for. They are going to go back out there. They're going to be your walking billboard with your product in their mouth, and they're going to talk about it. That you are going to be sure that you get something back from that to share with other potential patients or to attract other potential patients, like the success story, like the picture, like the Google review, and also you are going to get them back on the schedule for a cleaning regimen, because you want that patient to still be your patient, whether you're alternating him with the general dentist or you're having them just come back once a year. You're still keeping them in your system, which kind of goes in part with the implant warranty that we have discussed before. They have to come back for their yearly examination, alternating cleaning, whatever it is that you feel that particular patient needs in order to keep the implant warranty. So, you know, we have purposes as well. We want to make sure the patient is taking care of their implant. We want to make sure the patient's happy, and they're going to say good things about us and refer patients back to us, and they're going to want to come back and see us. So all in all, that's what the POT for or the graduation ceremony is for.
So see how you can adapt this graduation ceremony to your office. This is not frivolous. It may seem frivolous. It really has a defined purpose and makes a big, big difference in public relations for your office. That's it for this day's webinar, right?
Yep, and you guys have a nice Thanksgiving. It's next week. My goodness. So happy Thanksgiving, and we will see you when we return from Oregon.
Yeah, see you in a couple of weeks.
Have a good evening.
Bye-bye.